Welcome to today's video about 6 warning signs of high blood pressure, hypertension. Did you know that hypertension is one of the main risk factors for cardiovascular disease, affecting millions of people around the world? In the United States, for example, about half of adults suffer from this condition, many of whom do not even know it. High blood pressure may be silent, but its consequences can be devastating, leading to serious complications such as stroke. But, after all, what is a stroke? And what causes it in men and women? Stroke occurs when blood flow to a part of the brain is interrupted or reduced, preventing brain tissue from receiving oxygen and nutrients. This can happen due to blockages or ruptures in the arteries, and high blood pressure is one of the main culprits. In today's video, we'll explore the 6 warning signs of high blood pressure that you shouldn't ignore, understand the associated risk factors, and discover how to prevent and treat this silent and dangerous condition. But first, subscribe to Incredibly Healthy and turn on notifications so you don't miss out on our informative videos. Without further delay, let's get started. 1. Frequent headaches. One of the most common and disturbing manifestations of hypertension is headaches. Unlike the occasional headaches that anyone can experience, those associated with high blood pressure tend to be more persistent and intense. These headaches typically occur in the back of the head and may become more noticeable in the morning. The reason for this is high pressure within the brain's blood vessels, which can cause them to narrow, vasoconstriction, limiting adequate blood flow. This not only causes pain, but can also be a warning sign that blood pressure is at a dangerously high level, necessitating immediate medical attention to avoid more serious complications, such as damage to the brain and other vital parts of the body. 2. Blurred vision or visual changes. Hypertension can lead to significant visual changes, serving as an important warning sign for those who suffer from this condition. Blurred vision, or the perception of spots in vision, may indicate damage to the blood vessels in the retina, the part of the eye responsible for transforming light into visual signals that the brain can interpret. This damage, known as hypertensive retinopathy, occurs when high blood pressure causes the blood vessels in the retina to narrow, which can lead to a reduction in blood flow. In more serious cases, this can result in swelling of the retina, bleeding, and eventually, loss of vision. Identifying and treating high blood pressure before it causes irreversible damage to the eyes is crucial, emphasizing the importance of regular eye exams and blood pressure monitoring. 3. Fatigue or confusion. Hypertension can manifest itself in ways that are often overlooked or attributed to other causes, such as everyday stress. Excessive fatigue, even after adequate rest, may be a sign that your heart is working harder than normal to pump blood through narrowed or stiff blood vessels, a common condition in high blood pressure. Additionally, mental confusion or difficulty concentrating may be signs that the brain is not receiving enough oxygen and nutrients due to compromised blood flow. These symptoms may seem subtle or easy to ignore, but they are clear signs that blood pressure may be at a dangerously high level, requiring evaluation and management. 4. Difficulty breathing. Another worrying symptom of hypertension that should not be ignored is difficulty breathing, especially observed during light physical activity or even at rest. This sign can be particularly alarming, as it indicates that the heart is under significant stress due to high blood pressure, which can lead to heart failure. Heart failure occurs when the heart cannot pump blood efficiently to meet the body's needs. This can result in fluid building up in the lungs, known as pulmonary edema, which makes it difficult to breathe. If you experience sudden shortness of breath, it's important to seek medical attention immediately, as this could be a sign that high blood pressure is seriously affecting your cardiovascular health. Are you hypertensive, or do you have someone close to you who has hypertension? Share this video with your friends and family. This information could save their lives. 5. Irregular heartbeat. The presence of irregular heartbeats, also known as arrhythmias, can be a worrying sign of uncontrolled hypertension. When blood pressure is consistently high, the heart can become thicker and less flexible, making it difficult to function efficiently. This can lead to an increase in the heart's effort to pump blood, resulting in irregular heartbeats or palpitations. These sensations can range from simple discomfort to more serious and noticeable episodes, where it feels like the heart is skipping beats, beating too fast or shaking. Although arrhythmias can have many causes, their presence in someone with high blood pressure significantly increases the risk of serious heart complications, including heart attack and heart failure. Therefore, it is vital to seek medical evaluation to determine the underlying cause of arrhythmias and discuss appropriate management strategies. 6. Nosebleed. While nosebleeds can be caused by a variety of factors, such as dry air or nasal irritations, they can also be a lesser-known indicator of high blood pressure. In some cases, high blood pressure can lead to ruptures in the small blood vessels in the nose, resulting in bleeding. Even though a single episode of nosebleeds is not necessarily cause for alarm, frequent or heavy bleeding without an apparent cause may suggest that blood pressure is elevated beyond what is healthy. It's important to note that while nosebleeds can be a sign of hypertension, they often occur in more advanced stages of the condition when blood pressure reaches critical levels. Therefore, individuals who experience recurrent nosebleeds should consult a doctor for a comprehensive evaluation, including blood pressure measurement, to rule out hypertension or other medical conditions. These were some important warning signs of hypertension. Always be alert about them. Risk factors of high blood pressure. Now, let's talk a little about what the risk factors for hypertension are. Hypertension is influenced by a combination of genetic, environmental, and lifestyle risk factors. Understanding these factors can help prevent and manage this potentially serious condition. Age is one of the first risk factors. As we age, our blood vessels gradually lose their elasticity, which can contribute to increased blood pressure. This means that even people who have healthy habits can become susceptible to high blood pressure as they age. Genetics must also be considered. If you have first-degree family members who have been diagnosed with high blood pressure, your risk of developing the condition is higher. This suggests a genetic predisposition that may be exacerbated by lifestyle and environmental factors. Another very common risk factor is obesity, which is growing every day in our country. Having a high body mass index, BMI, puts extra pressure on the heart and blood vessels, forcing them to work harder and therefore increasing blood pressure. Are you sedentary? Careful. Lack of physical activity also causes hypertension. Regular physical activity helps keep your heart and blood vessels healthy, as well as helping you maintain a healthy weight. Smoking or using tobacco products is another aspect to consider, as it is a habit that can cause damage to the walls of blood vessels, narrowing them and increasing blood pressure. Additionally, nicotine can temporarily raise blood pressure. Other risk factors that deserve attention include having a diet high in salt, excessive alcohol consumption, and having a stressful routine. However, the good news is that you can prevent hypertension by adopting a healthy lifestyle, which includes maintaining a balanced diet rich in fruits, vegetables, and whole grains. Limit salt and alcohol consumption. Exercise regularly. Maintain a healthy weight. Avoid tobacco. And manage stress. Hypertension, although a dangerous condition, is treatable. Recognizing the signs it gives is very important for you to seek medical help. Treating high blood pressure often starts with lifestyle changes, like those mentioned previously. Medications may also be prescribed to help control blood pressure. It is essential to follow your doctor's instructions and have regular checkups to monitor your condition. Take care of your health. Only you can do this for you. High blood pressure is a serious condition that can lead to serious health consequences if not managed properly. Remember, taking care of your health is the best way to prevent diseases such as hypertension. Pay attention to the signs, and if you think you may be at risk, see a doctor for evaluation and advice. I hope you liked the video. If so, consider giving it a thumbs up. This topic is of public interest, so share it with your loved ones. If you're new to our channel, don't forget to subscribe to support our growth and hit the notification bell so you don't miss out on our next video. We're curious to know, did you know about these silent signs of high blood pressure? Have you or someone you love had these symptoms before? Share with us in the comments below. Your participation is very welcome. Before you leave, you may also find some other helpful videos popping up on your screen right now. Feel free to click on any of them, or even better, watch both to continue your knowledge journey with us. Thank you for watching this far. See you in the next video. Bye.